I'm Molly, as you know, from the mayor's office. And tonight, our presenter is Alicia Vaughn. And let me tell you a little bit about her, and then I'll turn the presentation over to her. Also, with us this evening is Jeremy with our IT department to handle all the technical issues we have. So Alicia is a principal with City Consultants and Research, LLC, and that's a firm with 20 years of experience in providing technical assistance, grant writing, and grant management training. She does this for cities and nonprofits who receive and apply for public and private grants. So Alicia specializes in assisting cities to obtain and receive federal grants from the U.S. Department of Housing and Urban Development. She's skilled in public engagement, fair housing assessments, and drafting, planning, and strategy development to meet HUD requirements. So she helps us follow the rules that HUD puts in place. Alicia's worked with communities and nonprofit organizations to acquire federal funding for various housing and economic development projects. Over the course of her career, Alicia's helped these organizations receive over $62 million in federal funding. So she's got tons of experience and she's been great to work with. Her experience includes partnering with cities of Lafayette, West Lafayette, New Albany, Mishawaka, and Hamilton County in the state of Indiana. She also serves communities in California and Massachusetts. Why she would want to serve communities in any other state besides ours, I have no idea. So Greenwood contracted with City Consultants and Research last year to assist us with the development of our consolidated plan and to assist applicants with their submissions. So please welcome Alicia Vaughn, and I'll turn the presentation over to her.
Okay. Thank you, Molly. And I just want to make sure I'm unmuted so you can hear me, correct?
You are loud and clear. Thanks.
All right. So welcome. I'm just going to start with some housekeeping items. So we're going to go through a short presentation about the Community Development Block Grant, or CDBG, and then we're going to have an open discussion following it. So this is where we're going to ask folks' opinions on different topics. If you could, in the chat, share your name and organization if you are here representing an organization. If you're willing to share your email with the city updated on progress throughout the year on the CDBG program. And I think we're going to keep everybody on mute, or ask that you keep yourselves muted through the presentation, and then we'll allow you to unmute and provide input after the presentation. If you have a question about the presentation, please include it in the chat. And Molly and Jeremy will help me monitor that so we can get you the answers. And I know a long way to be on Zoom meetings and WebEx meetings, but if you would, to keep your camera on, since it's going to be a discussion, that's great. But I certainly understand if you don't want to have a camera on. Okay, so let's dive into the CDBG basics. Great, thank you, Molly. So the CDBG program began federally in the 1970s. Greenwood's program began last year in 2019. Greenwood was designated an entitlement community of its population. So it crossed a magical threshold, and now Greenwood can receive funding every year so long as Congress allocates the Development Block Grant Program. Fiscal year for the CDBG funds is run through the 30th, And this year's allocation for 2020, which began a few weeks ago, the fiscal year 2020, is a little over $358,000. The allocation is based on a formula that HUD puts together using the number of people living in poverty in a community, pre-1940s housing stock, population. So it's a complex formula, but it's a effective formula that you use to figure out how much you're going to receive. The purpose of the program is to create decent, affordable, suitable neighborhoods, economic opportunities for the residents of Greenwood. And this is largely regulated Department of Housing, Urban Development, or HUD. So affordable housing can be kind of tricky. A lot of people ask, what does that mean? Well, affordable housing simply means we want residents of Greenwood to pay no more than 30% of their gross annual or gross monthly income towards housing costs. So we don't want them to pay more than 30% of their income towards mortgage, rent, utilities, taxes, those items. So we just want to be able to create a variety of housing for all different income types. So to give you an idea of what Greenwood are challenged by this, the consolidated plan last year looked at renter households and owner-occupied households experiencing housing cost burden, paying more than 30% of their gross income towards housing. 55% of renters in Greenwood paid more than 30% of their income towards housing. And that was according to the 2011-2015 American Community Survey. So that was the data the consolidated plan used. 37% of renters paid more than 50% of their income towards housing in Greenwood. So well over a third. Owners, the picture is very similar. 7% of owners lived with a housing cost burden, so they paid more than 30% of their income towards housing, and 50% of owners paid more than 50% of their income towards housing. So they were severely cost burdened. That's a significant number. Okay, Molly, you can move to the next slide. So we've kind of pointed out some problems, and so what can these funds be used for? All the activities need to meet at least one of three national objectives. And usually cities work to benefit low to moderate income individuals. So what does that mean to be a low to moderate income individual? In Greenwood, a low to moderate income individual is any person that's making less than $45,950 a year. That calculation is based on the income of all of central Indiana. So from partnering and being calculated with Hamilton County and some other donut counties with high incomes as well as its own. Another national objective that CDBG could meet is eliminate common blight, meaning that City of Greenwood can use CDBG to demolish unsafe buildings or clean up unsafe sites, brownfields, things like that, underground storage tanks that might be leaking. CDBG used to benefit that. Or it can be used to meet an urgent need. So in extreme weather conditions, if a tornado came through the community, meeting an urgent need, you could help rebuild your community with CDBG funds. There's all types of activities. CDBG is one of the more flexible HUD grants, federal grants I work with. So we can use CDBG for affordable housing. And I've listed a number of different types. The trick with affordable housing is we can't use CDBG for new construction. So you can't build anything new. You have to renovate it. We've also listed public services. And Molly, I don't know if you can move your cursor to eliminate the menu that's kind of on the left presentation. Anyway, public services. There's a wide services. I've only listed a few of the eligible public services. I picked some of the more popular ones that some of the communities I work with pick. Food pantry assistance is always very much at the top, as well as helping seniors. I gave an example. Meals on Wheels is a great example of public service. Next slide. Economic development is another type of activity that can be used, CDBG can be used towards. It must benefit low to moderate income neighborhoods or support the creation of low to moderate income jobs or help low to moderate income people. I gave an example of improved facades for businesses. So I'm going to compare it to a similar program that Greenwood already has, which is the Greenwood Grow program. I mean, you can go to, I think everybody here might be familiar with it, but if not, you can go to greenwood.in.gov/grow to find out more information about that. But that's a program where facades were improved for downtown businesses, and that is a CBG eligible activity. And public facility improvements, there's a lot of different possibilities here. Something not on the list that was something the survey, and we'll talk a little later about the survey. A lot of people have suggested they would like to add or improve trails and walkability of the community, and that CDBG eligible expense. Like in the picture here, we have the new Madison Trail, and this is a great example of a CDBG eligible activity, although it is not CDBG funded. It's a great example. Something important about public facilities to remember is that while there's many types of facilities that can be improved, we cannot improve publicly owned buildings. So libraries, firehouses, the city building can't be improved using CDBG funds unless it's to make it more accessible. Next slide, please. Great, thank you. So we've talked about the eligible activities, national objectives. HUD also asked the city to create a consolidated plan. I talked about how I worked with the city last year to create the consolidated plan. And it was last summer, which seems like eons ago. And it was submitted and approved by HUD in August of 2019. A consolidated plan requires data analysis, public input from the community, stakeholders. I went out and interviewed individual stakeholders and members of the community. And it also asked the city to set goals that they would like to work towards over the next 5 years. So last year, we tried to set goals in a very general sense to make sure that we restrict the city in any way, that it was very open-ended for the types of projects to be funded. So when the community selects projects to be with its CDBG funds, it has to meet a goal of its consolidated plan. So the first goal we picked was to increase the amount of safe, decent, affordable housing in the community. And so we're thinking of things like provide owner-occupied repair for seniors so that they age in place, maybe make accessibility improvements, that sort of thing. But it can also be used to provide rent assistance to prevent evictions for renters who might be experiencing problems with COVID, or mortgage assistance. The next goal was to support programs that help the most vulnerable households in the community. So senior services, food pantries, youth services, childcare, daycare to help people go to work. The third goal was to invest in public infrastructure to create more walkability in the community, make sure the community is accessible for all, adding ADA curb cuts, and also improve parks for the neighborhoods. And then the last goal is to advocate for fair housing. And by advocating for fair housing, the city of Greenwood is working to ensure anybody who wants to move to Greenwood can and doesn't face discrimination when they do try to move to Greenwood. So while it's a really admirable, this is also one that HUD requires. So that has to be in there. So we have this consolidated plan, as we said, but it was we created it last year. Like I said, it's before COVID, seems like more than just a year ago. So what we're doing right now is getting input from the community of what's changed. What do we need to change? Do we need to change a goal in the consolidated plan? What types of projects do we need to fund with CDBG? And the input from this meeting and the survey, which was our first step, will help us as a community determine what the CDBG fund should be used for. So I'm going to kick it back to Molly to talk about the survey findings thus far.
Thanks, Alicia. That's a really good descriptor. And so the unique challenge that we faced was all of the data that Alicia helped us collect and all of the information we had going into this year got disrupted by COVID. And so the first action we have taken is to reach out to folks to take a survey so we can kind of wrap our arms around what's changed, what needs do we have after COVID. Wow, what was that? Anyway, so I'm pleased to report that we sent a survey out a week ago, and we've already received over 50 back, and they're funneling in very heavily, which we greatly appreciate. I would also encourage you to forward the survey to anyone you think would like to have input. We're looking for all the input we can get, but we've compiled a few preliminary things so that you can see how the data is shaping. So what you see on the screen right now is a word cloud. So we created this from all the responses we've received. So the larger the word, the more people have used it in their written answers to their responses. And so it was more often used in responses. So this just gives you an idea of what things were in the responses that we've received so far. So one of the first things I'll show you is where the responses came from geographically. And as expected, 76% came from Greenwood. Some of them came from outside the city. They were mostly from service agencies and nonprofits that serve Greenwood in some capacity. So like a lot of our social services and services in Johnson County are located in Franklin. So 12% of the responses came from Franklin for that reason. When we looked at the age of the respondent, they came back as expected. Sorry, I'm tongue-tied for some reason. So it spreads pretty much across the age ranges. So nothing really revealing there. So then we asked, how did COVID affect you? Most of the responses said no impact. 29 of the 50 responses that are recorded here said not really anything. From those that did have an impact, business slowdown was the only category that had more than one response. So folks in the area have fared fairly well in COVID. So then we got to the crux of what we're going to talk about tonight is what kind of projects should we be spending our money on? And so there were two categories that stand out in the data, and they are rental assistance to prevent evictions and small business assistance for locally owned businesses. Those seem to be popping up more readily than the other things. Although the other items are very important and we will be looking at them. So then we broke it down by projects and asked about projects. So we gave some examples of different types of projects that could be covered by CDBG funds. So 30 or 29 of the 50 responses suggested we should add more sidewalks and pedestrian paths to make sure neighborhoods are walkable. Sorry that got cropped a little here, but walkability seems to be a theme that keeps popping up. Then we asked specifically about housing projects, and the rent and mortgage assistance popped up again. So that's obviously on the top of people's minds. So we'll look rather heavily at that. Preliminarily, we'll look to get examples of projects that cover that. So that was all the survey. And now I'm going to turn the microphone back over to Alicia to walk you through the community discussion. And so here is the word cloud, just so that you can get thinking about your ideas. So Alicia, you're back on.
Thank you, Molly. So as we've mentioned several times, the last planning document we put together to figure out how to use CDBG funds was before COVID. But it's very important every year to talk to the community and find out what these funds should be spent on for several reasons. One, the data only tells us so much, and it's cold, if you will. I like having a human touch by talking to folks that live and work in the community to find out what's really going on. And also, the plan is a plan and it can be amended. So if we need to change something from last year, that's just what we need to do. And it's always good to check in to see if we're headed in the right direction. So that we've gone through all of the ins and outs of CDBG, we're going to have an open discussion with a couple of questions to help facilitate that discussion. So everybody can unmute themselves if they want to contribute to the discussion or answer the questions. I just ask that we try to keep everything in a very positive mode and safe for everyone. Everyone's opinion is welcome. But if you have a complaint or feedback for the city that doesn't really kind of fit this topic of what we're kind of talking about, please include it in the chat. That way we can get the comment or complaint to the part of the city that needs to hear it. Also, if someone else is talking and you just want to get your question out there, the chat function is another good way of doing that. Or if it's just coming up on dinner time and you need to leave, make sure you get your question in and we'll get responses, because this recording will be published along with some responses and just notes from the discussion, I think, on the city's website. So we'll just, I think everybody's unmuted so we can go to our first question. Molly, if you would. So our first question is, we provided the survey with a number of different examples and questions. What are in that survey? Is there a project or program that we should be focusing on that maybe wasn't mentioned in the survey? It's good to see everyone's face.
It's not my cat that's meowing, by the way.
I don't have any pets, so it's not mine. When you were talking about what projects are missing, I mean, are you talking about from projects you had identified from last year to this year, or are you talking about?
I think I'm asking, what would you like to see funded that maybe wasn't in that list on that survey?
Well, one of my questions too was this money that's allocated for Greenwood does it have to stay in the city limits of Greenwood? For example, the surveys that came from outside of Greenwood, this money can't go there, or can it?
That's correct. That's a great question. Yes, it has to stay in the city of Greenwood. It must benefit city of Greenwood residents. So if a provider is outside in Franklin or a different part of the county, they have to serve a Greenwood resident in order to receive program funds.
Alicia, this is Leslie Doherty. One of the things I thought was missing, I mean, you talked about funds to prevent eviction, which is important, but one of the things that we've seen in the data that we've gathered with Bridges Alliance is just the lack of affordable housing in general. I know Molly said there's some efforts to help with that, but I mean, there's nothing for people that need to rent at like $500 a month or need a house that's $100,000 a month. It doesn't exist. Mm-hmm. And we have people that need those kinds of facilities.
Okay.
So I guess going along with what Leslie said, from what we've said, there's $358,000 for 2020. And we're looking at trying, for example, to come up with some affordable housing. How do we implement that money? Because $358,000 obviously isn't enough to go build some affordable houses. So how do you implement that money to make it work?
That's a great question. So in a lot of communities, they work with private developers, and the private developer will build the housing, and then the CDBG money is used to subsidize so it can reduce the cost of the build for them to build the housing. And so then developer can either rent the housing for less or sell it at a lower price than what the market would bear.
So did you say earlier on in the conversation, did you say that this money can't be used for new development?
Brand new development, but they can renovate a building or renovate a house.
Okay.
Done work, and you kind of talked about this with businesses, and I joined a little late, Alicia, so I may have missed something, but so I think some communities have used it to improve the facades of neighborhoods as well, from curb to yes. door, for instance.
Right, exactly. The city of Greenwood could target a whole neighborhood and say, this neighborhood is going to be our focus. So we talked about that it's $358,000 this year. But, as long as the appropriation keeps coming every year, and it has since the 1970s, it's probably going to hover right around that amount.
Is that calculation based on how is that 58? Is it a percentage of something? Is it?
So Congress allocates every year, and then HUD implements a formula. I've worked in 20 years with different people to figure out how this formula even works, but there's different things that go into it. But yeah, it's formula based.
Oh, it'll be roughly the same.
Yes.
Okay.
Fingers crossed that it is. Yep.
So are there any projects, is there anything that most of you responded to the survey? Are there any categories that we're missing? We're kind of looking for general things that we're missing, any holes that we have. And you don't have to answer tonight. If you come up with something, feel free to shoot them to me. And
Molly, could you just put your slide back up that shows the projects that were suggested already?
You bet.
Thank you.
I'm not near as good at this as you are, Jennifer. Oh, that's it. Right here.
So we picked some of the top or more popular programs and projects that communities are doing.
And then we just, so here are some of the more popular ones, and these are general project types, and these are housing project specific.
Okay, yeah.
So walkability was the highest on the other one, and rent or mortgage assistant is the highest.
On the first one,
Okay.
yes. So assisting small businesses and rent assistance are both have been coming back high. Now understand the total number of responses was only 50.
Yeah.
And since we compiled this data yesterday afternoon, we've received another dozen or so surveys. So we'll keep the survey open until the end of October. So please encourage people that you know that are interested in this topic to respond. Like Leslie, anyone from Bridges, we would really love to hear from your folks.
Yeah. I did send it to him. I'll keep bugging him.
Good, that's good.
Like,
I
do you
mean,
track the various income levels of the people that participated? I don't remember if that was asked when I did this.
it was asked and it has been responded to, but we just didn't put it in this.
Yeah.
Do you know off the top of your head, like, I don't know, where was
I
there?
do not.
You don't
I
know?
don't know.
Okay.
And I have a question. In the past, so walkways versus rent assistance in the past, the 300 and some thousand, how has it been allocated in past years, kind of as a percentage? I mean, can we say what's been rent assistance in the past versus other projects?
So so this year is a unique year because we got our allocation for CDBG of just over 300,000. And then we got additional money from the CARES Act. So we got an additional, Alicia, I don't know the total.
Yeah, give me a moment and I can pull up that number.
So so here's what we've done so far. Last year's CDBG money was allocated to 3 projects, 2 of which are, so approximately 150,000, and I'm just pulling this off the top of my head, Charles, we can get you exact numbers, went to renovate the Northeast Park skate park. And our plan is to fund another 100,000 to that project from this year's money, because to finish the project, so we don't leave it hanging. We also renovated the socials kickboxing area.
We're funding that. Well, we didn't renovate it. We're funding the service of it, but yes.
Okay. Alicia's much better. I got in on this team during COVID.
Well,
So I'm very familiar with all the food pantry project and the rent assistance. So Nancy's on the phone. Let me stop sharing my screen so that I do very poorly when I don't see people. Anyway, there's Nancy. So we've done about 121,000 to food pantries and rent assistance, 100,000 going to the United Way, because they are the only service agency that we could identify that was already had a process set up for rent assistance. And they've really been at the head of supporting the entire county on that. So of the funds that were contributed to the United Way, only Greenwood residents, it only funds Greenwood residents. So that's the catch with this fund. It's only Greenwood, which got very sticky when we found several food pantries who needed help and had experienced a tremendous increase. However, they were nervous because They weren't sure how many people from Greenwood they were serving. They weren't really documenting it prior. So we're just getting started and they're doing really great.
So I want to give props to the providers, because to start a new program with CDBG is very difficult. And so they've taken on a very difficult task with all of these funds coming in. So it's $300,000 from 2019, $358,000 for 2020. And in the middle of it with COVID, and I put it in the chat, just over $515,000 of CARES Act funds. So it's a lot of money coming into community where we're just starting to build the network of providers to work in the community and really be able to work in the community.
And if I can just add, the question about COVID and that people hadn't been infected, I just pulled up the statistics. And I think we've missed a different demographic, Leslie, when you asked, or Jennifer, of the over, just a second, 224 clients that we have in Johnson County that's been affected by COVID. 111 of them fall in the 46142, 46143 zip code. So the Greenwood area has been affected. I just think probably the survey didn't.
Yeah, let me explain who the survey was sent to. It was mostly stakeholders. I actually swiped Jenny Kinnaman's, the United Way's service email list, because I didn't have a good one. So most of these are stakeholders and providers of service, not necessarily, we aren't reaching, and this is the reason why all of you are so important. We need that network of people who are low to mid income, who need help. We are having trouble identifying them. So all of you work in that area and are much better at this than our internal staff.
I forwarded it to all of the circle leaders, Nancy, but when I answered the survey for myself, I have to say I'm not affected.
Right.
Because, I'm retired. I'm in great shape, but I forwarded it to my circle leaders. Now getting them to respond is something else, but that's what we have to do. And that's, yeah.
Well, and building on that that's why it's important to get input from stakeholders like yourselves, because you are working with those individuals and what are they seeing, so that we can make sure that we are finding programs and funding programs that address their needs. So I'm going to ask the second question of what challenges are you seeing Greenwood residents as this pandemic continues? And I'm going to tell a little story. I'm just working in one particular community, Hamilton County. When they did a survey, and we were thinking, oh, everybody needs rental assistance. That's going to be the big issue. This is what we thought in April when the first CARES Act allocations were coming, is rental assistance. People are not working right now in April, and they're going to need help to pay their rent. And we had a sole individual say, well, no, childcare. We need to fund childcare because the childcare centers aren't open and we need to keep them open. And at the time I was thinking that I don't understand. The rent seems more important. And here we are a number of months later, and childcare is an important issue. Because people can't go to work if they can't have childcare, and they can't afford childcare if they're not working, or look for work if they can't have childcare. So we want to make sure that we're thinking of all the different possibilities of what people are facing as this keeps going and going. It seems like every week there's just a new issue that we didn't think of before.
Alicia, what have other communities done with these funds for childcare? Have they just created like vouchers, or can you share past projects?
Well, that's an interesting thing. Even with that cute little story, they haven't done anything. They're still doing primarily rental and utility assistance and mortgage assistance. A few other communities have done small business assistance to help small businesses. But again, those grants were very minor and tiny, and we yet to know how effective that is. The city of Lafayette has a big business assistance program as well as West Lafayette, and we still don't know the final results if they've been able to keep businesses open that have been struggling.
I'll speak up on the child care. We also thought that child care was going to be a huge issue in the very beginning. And I will say, I think Girls Inc. and the Boys and Girls Club of Franklin still have openings open. So even though they are at, I think they're at 25% capacity, they still have openings, and usually they are fully. I mean, they have waiting lists. So I'm not sure people are real comfortable yet sending their kids to childcare. That is just my opinion. I have no facts on that.
And Nancy, you make a really good point. And here's what we're discovering. Both of those organizations are located in Franklin.
Mm.
And so therein lies the challenge. We don't have those same resources here in Greenwood. And that's, so we are struggling to find where to put this money because we don't have those things here in Greenwood. So, you know, like Alicia alluded to earlier, is trying to establish some service without the fun. I mean, it's the chicken and egg thing. But we know that it's consistent, and we need to think strategically here to establish something to serve Greenwood.
Yeah, and I will say the Boys and Girls Club would love to open a facility in Greenwood. And they actually did change their name and to the Boys and Girls Club of Johnson County.
Yeah.
So that they could do that. And there's some rules and regulations that the Boys and Girls Club of chapters have, and they have met those so that they can expand. So they are opened to doing that because they want to expand. So
So if childcare, we've got that. Are there any other things that you think are going to be challenges for Greenwood residents as this pandemic continues?
Well, one of the things that, I mean, to use an example, and the person works at a place in Marion County across from the mall, but this is an example, is that during the first couple of months of COVID, the person makes $2.13 an hour. That's their wage as a service worker. And they would get tips normally. Still low, but they would get tips. So during the first couple of months of COVID, because the owner got PPP, one of the protection elements was that they had to pay them $9 an hour, I think, or close to, maybe it was $7, maybe it was minimum wage, but per hour they made more, right? But now that's gone, right? The PPP piece of that was met, it's gone, and so they're back to making $2.13 an hour, but the rest at whatever capacity it is, and mostly and at night, on the third shift, it's all carry out. So there's a person who's affected, but still working, and I don't know, the retention of employees, I guess, is in my mind, it falls under. And it also falls under what you talked about in terms of keeping small businesses open. I don't know if this is, I would call this a small business, but
I think that's a great example, and I don't want the group to worry about how it fits into the CDBG world. That's why Greenwood's asked me to come on board, is to figure out how to make it fit. And there's an amazing amount of stuff that we can get to fit if we can just
And
list it right.
Alicia's the
So
best at it. She's done a
What
really
about-
great job.
Public transportation.
Mhm.
It didn't look
What's,
like anything.
What
was
do you mean
submitted
by
about that.
transportation? Can you be more
Well,
specific?
I don't know. For those that take the red line to the mall, I've heard from lots of employers that their lower, like entry level jobs don't necessarily have cars. So how do we get them from the red line to their job?
Okay, so in Johnson County. So Alicia, the red line ends at County Line Road. So there's no bus service that goes south into
Right.
Johnson County.
okay.
Well, Access has a route. Access Johnson County.
Yes, I'm sorry, you're right. You're right.
Doesn't that just go up and down 31 though?
No, it's got a variety of routes, and it also has an on-demand service too. So
which has been full and had a waiting list pre-COVID of about, I don't know, 60 people were on the list or something that they didn't have room for.
yeah, and their funds have gotten cut, and that's part of the problem.
Since
It's-
COVID?
Their funds got
Before.
cut.
2014.
Oh, okay, okay.
But they don't run at night either. So people who want to take advantage of Central 9 classes in the evening, for instance, or other work, to increase their work
Okay,
ability, is an issue.
Okay.
Yeah,
That's a good one.
they were transporting until 11 o'clock at night until their funds got cut. And I think that was about 2000, this is 20, isn't it? It was about 2016. They had a huge cut. And so they were actually transporting on Sundays. And so they couldn't do it. And they keep getting cut. So.
Charles.
All right. This is the last time I'm going to apologize for being brand new at any of this, but I apologize for being brand new at any of this. So when do these funds become available each year? When is the next funding?
No, so that's a great question. So this year is an anomaly because we're a little bit behind the 8 ball. So next spring, we will plan for 2021, but they become available October 1st. So these funds, the 358 and the 515, they're available right now, as long as we can figure out what we're, as a community, going to fund.
So the 358 became available October 1?
We do need to submit an action plan to HUD to say what the community wants to spend those funds on. But then
it seems to me like COVID is the priority. So to me, things like curb cuts and walkability and some of those sorts of things maybe are being done through other grants and things. Is that right, Molly? I mean, the trails and the Madison walkways, that's already in progress, right?
Yes. And that's a completely different fund.
So we have a short-term big issue here, which is COVID, and whether that's employment issues, what have you. That's going to be something that's going to affect this community throughout 2021. Let's say from October 1 through the next October 1, maybe. So for the next 12 months, maybe. That's going to be something that's huge for this community, is COVID-related things. And what's that going to be? Is that daycare? Is that transportation? Is that rental assistance? Whatever. So it seems to me we could narrow it down to exclude some of the things that may have happened in the past when we didn't have these perhaps larger issues. That's just my 2 cents worth. And then, so those are short-term issues. And then later on down the road, the thing that pops up to me is, Alicia, some of your statistics about 30 to 50% being spent on rent or mortgage, et cetera. I'm ignorant and it's hard for me to fathom that. So that makes me think of things like wages and economic development, not
Oh, yeah.
necessarily how do we keep pouring money into rental assistance, which is this bucket of money. I realize I'm talking about different
That's okay. It's my job to figure out the buckets.
but
You tell me what's
economic
important.
development and wages and what businesses are we trying to get in to the community is a different issue that would lower the amount that people are spending on the percentage that they're spending on housing, et cetera. So to me, we have a really big short-term issue here, which is COVID. And just as a side political note, whatever, I believe in COVID. I believe it's real. I'm all about wearing a mask, and I've got family members that are high risk, et cetera. So, but I'm hoping it's a short-term issue, and I think that's what these dollars should be earmarked for. If this is the demographic that is really struggling through this, and it's hard, like Leslie and some of the others are saying, it's hard to probably really get a survey from the people that are truly affected. We're getting surveys from those that are providing the services, which I understand. But who are those on the front line? Okay, now I'll be quiet.
No, great. And good points, Charles. So this is why we need your help. So even a verbal response, we'd be happy to talk to anyone. We just are having trouble identifying them, or I'm having trouble. Alicia probably knows much better where they are, but you all know where and who these people are and can help us identify them. We've had a couple of really good conversations with Ken Koenig with Greenwood Schools, and he's been very helpful and has a few suggestions, which I think are very valuable. Let me be the first to say I'm terrible at posting online things because I get so wrapped up in the conversation, I don't look at the chat box, but I'm looking now. And let me catch up and answer a couple of questions so the group here. So Jennifer, you asked about the survey and people of all income levels. The answer to that question is definitely is more service providers than actual, but if you have a network of people that you could send it out to, please do that. That would be very helpful. We are trying to reach low to mid income people who need help. And if you can help us do that, we've also reached out to several churches who have really good networks of people. So I'm hoping that gets some response as well. Someone asked about the timing on the action plan. We're targeting December to wrap up the plan. So we'll close the survey at the end of October, and then we'll get more data from Alicia, and then we'll put it all in a tumbler and shake it all up and see what comes out. Well, that's the non-technical answer. That's what I think we're going to do. All right, so
that's what people will think you're going to do anyway. No matter what happens, they'll think that you did that.
No, I really am encouraged by the response we've gotten so far. We've gotten a lot of suggestions and a lot of good comments, which aren't summarized in today's presentation. We'll get a good summary and see. I really want to push out all this information so we can continue this conversation. But because we are rounding up to 6:30, I really want to be cognizant of your time. So if we think we've answered question 2, I'd like to move on to question 3.
Right. Going to build on to what Charles had already mentioned was working with workers and businesses and creating the job opportunities that would increase wages. And so our question 3 is in that same vein of what challenges do local businesses and workers face? What sort of supports can those groups, businesses, and workers use to increase their wages? Is it more training, education, tools, even? Just brainstorm what you think would help those folks that are just wanting to increase their wage. I think we already even touched on it about the person with the challenge with tips and going back to work and not having the PPP as well.
Charles's comment about, I mean, you want them to have better jobs, but you're still going to have people in those service jobs. And so if they're still paid $2.13 an hour with tips, that's a problem. They have to have somewhere to live. So, Ezra, I'm sorry.
And
I was going to ask if there's any information as far as like how many people are unemployed in Greenwood because of COVID, or any kind of number at all that says, hey, in Greenwood, there's 10,000 people unemployed right now because they lost their job because of COVID. Or I guess, how do we determine what kind of number we're dealing with, in a sense of, okay, we have a number of people, and then what can we do? You know, is it a matter of, you know, they've been furloughed and they're planning on going back to where they were, or they've lost their job indefinitely and they need to try and find a new career? Or, you know, I guess that's sort of, I don't know if Greenwood has, or Johnson County has any access to information like that of how we know who needs work.
We have statistics on the county, but we don't have it by Greenwood. I will tell you, it's all over the place as far as, and I'll be honest with you, people ask me, what's the industry that's been hit the hardest and where are they coming from? And they're coming from all over the place. Whether it be restaurants, whether it's really odd. I mean, in the 2008 and 2009, it was manufacturing. It is not that this time. It is a variety of places. And so, so most of them are not being furloughed. They are losing their job. And so, it's trying to get them into that realm. Many of the jobs that we have available right now, there are just a certain population that just cannot do those jobs, as far as the warehousing and things like that. If you're looking at somebody who's 45 years old, and I'm an Amazon customer, so don't get me wrong, but loading boxes and that routine, that is hard on somebody that's 45 to 65 years old. And so that type of work is hard right now. So
yeah, I understand that too. I run a construction business as well, and I know exactly what you're talking about. And I also struggle to find employees. And I guess, that being said, when you have a demographic of that age range, how do you figure out what they can and can't do? And does that go to training or education that, hey, they can't work a shovel anymore, so they need to do something else, but they need somewhere to go to get training or education to try and find a different job or career?
Mm-hmm. Yeah.
So we had a long discussion with Central 9 and their adult education programs. And I think Michelle Davis runs that program, and she had several ideas for workforce management and retraining and that type of thing. So if any of you know or have any suggestions in that area, or know of people who have expertise in that area, who are familiar with the Greenwood or Johnson County area, they would be very helpful in helping us come up with a plan to train people, retrain people, help them, help find labor for construction and for these warehouse situations. That would be very helpful. I also know that Johnson County Community Foundation is working off a Lilly grant to support business and help people. They're piloting it with a logistics company. I don't know that they've picked a specific company, but they're trying to support the lower end, the $15 an hour Amazon type person, how to help them thrive in that, or move up, or retrain, or leverage what they've already started. So,
Right. And
Have
we
you
may be
met with
talking.
oh, I'm
Go
sorry.
ahead.
I was just going to add one more thing. Have you had any conversation with the Chamber of Commerce as far as their businesses? Do they have an avenue of, hey, here's our members, and they can tabulate something to, or set up something where businesses can come and say, hey, here's jobs we have available. Push this out there for people looking for a job or someone
We have
looking to
We
hire
have a
work.
job bank on our website, Ezra.
On your website.
Yeah, on the Aspire website, there's a job bank for openings.
and that website is Aspire Johnson County.
Okay. Well, what do you guys do to get that out there so people know it's available, I guess?
I mean, I've promoted it on our social media, and I know it also goes out in our member newsletter, but I don't know that they put it in there every week.
And I
And
think
I've also spoken to our our employment agencies, and they've been sending me jobs, so they know it exists too. But I'm open to other suggestions if you know of other things.
And I just want to say this is part of starting a new CDBG program. And one of the challenges is letting everybody know that there's programs out there and now there's funding for the community as well. That's the other amazing piece is there's funding for it rather than just saying these services are out there and good luck. We've actually got money to support the services so that if you connect, there's funding for that. It's a natural growing pain is trying to get at.
It's true. And Ezra, just so you know, we have had many conversations with Christian Maslowski about brainstorming how to better support our businesses. He's been very involved with this group.
Right. And a lot of these stakeholders, along with the chamber, were consulted as part of the consolidated plan. It's just, that was, 600 years ago last year. So
Sorry, I don't want to keep
No,
talking
keep
either.
going.
no, please do.
But last year when you allocated your funds, how did you determine, what was the final factor in determining where the money went?
So the city determined there was a couple of projects they wanted to allocate towards through the Parks Department and to do some ADA improvements. But I talked to stakeholders, I looked at statistics, and because it was a brand new program and we were working pretty fast, normally a consolidated plan takes several months, and we did this one rather quickly. We tried to pick projects that would be easy to implement for a brand new program. So by that, we picked projects that would have an easier time meeting some of the CDBG requirements, income requirements, that they served a presumed benefit. Either they served homeless individuals or seniors. And so we kind of picked two big categories of programs that would serve those kinds of individuals so there'd be less paperwork for any new organization coming in. And then we opened up for an application process to see who would be interested in doing that type of program. We also set aside money for an affordable housing project, but that wasn't able to move forward. So we even have funding from that project to reallocate this year.
I just have one more thing and then I'll be quiet.
No, you're fine.
Okay, I've served on the council for 9 years now, almost. And I guess one thing I've experienced over the years is sometimes someone will ask or inquire about, someone needing help or, whether it be with, groceries, paying their rent, utilities, and they're like, where can they go? And sometimes I don't know. And I'm naive and I should probably get in this more, but I don't always know what to tell them. Like as far as Greenwood goes, I don't know where to send people in Greenwood. Like, hey, here, go here, and then they can help you or direct you to get assistance, I guess.
So Ezra, Nancy, do you want to answer that question?
I sure can. We have a helpline, and sorry, my dog is really bothering me, so I apologize. The number is 738-4636, and it is available 8:30 to 5. So it is our helpline. It's where people call for those questions and answers if people need assistance. So
based on, sorry, I'm talking more, but based on that, what information have you got through this helpline, I guess, recently? Because I guess what I'm trying to get at here is, with this amount of money, how do we find the people that need it? And at that point, how do you determine exactly what they're needing as far as, I don't know, I guess, if it's COVID related or they need to find a better paying job or whatever. I guess that's my other question too is, and I know it needs to be, on us too, to help bring awareness too, but I guess, how are you determining, who needs this money? And I guess that's basically it.
Are you asking us? Are you asking me what type of calls
Yeah,
we're getting?
you were talking about the helpline, right?
Sure. Yeah.
Okay, sorry.
Yeah.
Yes.
So,
Nancy, yes.
our number one call is housing related. So I ditto exactly what Leslie says, is we do not have affordable housing. And you're always, our statistics that we have done, we also had a housing study done in 2014. And it's exactly spot on what Alicia was saying, is that we have people paying upwards of 50% of their income towards housing. And
At least.
yeah, and it's, and I will say, it's just not, it's just not an income issue. It is it is hard to find an apartment any place for under $1,000 in this county. And, my daughter's getting ready to graduate from college with a degree, and she's not going to be able to afford $1,000 off. Also, it takes about $2,500. You asked the question, sorry, or I'm keep going, is that it takes about $2,500 to get into housing, between deposits, utilities, and all that. So we got into the housing space because our calls in about 2012 started to be the majority of them, 60% of them were housing related, whether it was being them evicted or they didn't have a place.
And then after you get evicted, even after you pay off the eviction, some renters won't rent to you until you've spent 5 years after you paid off the eviction. What you're supposed to do for 5 years, I have no idea.
So I have to.
So sorry, Molly.
No, this is good.
It's our soapbox, right, Nancy?
I don't want to cut you guys off. I just,
No, it's okay.
I'm aware of the time, but I also want to give a shout out to the United Way, because they totally pivoted during COVID and have been amazing. And their structure was such that they were one of the only places that could identify and had the process set up so they could, we funneled $100,000, and we're talking about another distribution to them as they need it. But they've been really, really great. And the whole list of people that we sent all this survey out and this meeting information was the United Way's list. So they are really tapped in and doing an amazing job. And I don't know if any of you got the emails from the United Way during COVID, but almost daily at the beginning, they were coming out saying, here are the services, here's help for people, here's everything under the sun and what every agency was doing. It was very, very helpful.
Well, they're kind enough to cover, you don't have to be a United Way agency to be on their list. So that's helpful. So Ezra, there is a network, but it can be difficult. If you're not plugged into that, it's hard. Even if you're plugged in, it gets confusing.
Mm-hmm.
But we keep learning.
So is the United Way that you're talking about, do they have a office here in Greenwood, or where are they out of?
No, it's in Franklin.
Franklin.
Okay. Well, do you think we need to look at trying to get an organization like United Way that can operate out of Greenwood? Would that help and make, or?
It could be, but I've also worked in communities where the city houses just a facility, and those agencies have satellites in that city that are open. And that's worked out really well for them. And I would say those communities are a comparable size to Greenwood. And that's really worked out. In fact, Lafayette, they have the North End Community Center, and it's an amazing community center that's not only a kind of a health club like a Y, although it isn't the Y MCA, but all of their providers are there. So it's a one-stop shop for that community to go in and have just everything there. So that could be something in the future for Greenwood.
That would be helpful. Yeah.
So what Dr. DeConnick said is the school's looking for a single resource because Kent feels like their teachers and their their counselors and their nurses are all trying to help, but if somebody's car breaks down, then they can't get the child to school and they haven't had breakfast, and the teacher spends 4 hours trying to get the car repaired and trying to figure out how to fix that. If they had a resource that they could send them to, he told me that teaching the curriculum is the easiest part of their job and the thing that they do the least of right now, especially during COVID. So he's been talking to one of the local churches to potentially set up a resource, which I said to him, let's keep talking because we could potentially fund that to make it available to folks outside the school as well. So
yeah,
you're thinking right along the same lines, and it's conversations like this that will help us all say, so what are you doing, and what are you doing, and what can you help with, and let's get them put together and then get that word out so that folks can find it. It's pretty cool. So I'd like to move on just to the last question so we cover everything. And then we certainly are here for as long as you guys want to chat about things. So our last question is this, which we've kind of covered a little bit. But...
Right. And I know Nancy has told us the number one call is housing needs. But what I'm trying to get is, how can we make the day-to-day life of someone that's really just kind of living on the edge, paycheck to paycheck, a little easier? And I realize
Well,
it's a loaded question in 2020.
I mean, you mentioned just the example that Molly just talked about with transportation. So somebody misses the bus, wakes up late, whatever, and they don't have transportation. I mean, there's no bus service that can get them to school. I mean, if they miss their bus, I mean, if they have a doctor's appointment or whatever, there's public transportation that can help them out. And it's frustrating.
Yeah.
And Lyft and Uber don't, they'd rather not transport people that are under, a certain age. That's really not a good, but it happens.
I know where you're I know where you're going. So yes.
So, just an example.
I would say outside of COVID, if we ever get back to normal, it's childcare too.
Okay.
Okay.
I will. Childcare is very expensive, and for those people who are living paycheck to paycheck, spending $100 to $200 a week in childcare,
It's huge.
you can't afford it. And
Right.
so I think outside of COVID, that is one of our biggest challenges is childcare. And in Franklin, they have the Boys and Girls Club and they have Girls Inc. And so it's very affordable. So, I lived in the Center Grove area and I actually transported my kids via access down to the Boys and Girls Club so that they could go to the Boys and Girls Club. So, it's affordable childcare and quality child.
That would help Greenwood a lot. I mean, that would really, growth-wise, would be amazing, I think.
Okay.
And
So if you have thoughts, you are most welcome to, every one of you has my email. So please, this isn't the end of the conversation. This is the beginning of the conversation. Also know that we have established a landing page for all things CDBG. So you can read our consolidated plan, all of our, the projects that we've taken on, we've got them listed there on the page. So you can find out about that. The survey is there. So if people ask where they can find the survey, please go to our website, type in /CDBG and it'll take them right to the page.
Molly, I don't know if you could get this information from the library, but they've been doing those, are they called Harwood conversations?
I'm sorry, the what?
The library, JCPL's been doing those Harwood conversations, I think they're called. Is that right, Jennifer?
Yeah, the library as well as our community engagement team has been doing them together.
Right. And sorry, I knew it was more than just the library. But I don't know if they can break down any of that stuff into just Greenwood groups, but they've been reaching out to citizens in the county to say, what do you want your county to look like? What's missing? All those kinds of things. And so there may be some data from them that would be helpful too.
Awesome. So, okay, that's a good idea. Okay. And they're called Heartland?
hardwood,
Heartwood.
hardwood.
I'm sorry. It's late.
Put it in for you. That's what I thought. Yeah.
Okay, I got it. Okay.
Who's doing it from is it you or who's working on it from your group in Aspire? Lisa?
Yeah, me and anyone on our community engagement team, we've just been taking turns leading small groups, maybe like 12 to 15 people around the county.
Right. So Jennifer, I'll follow up with you on this.
Okay.
Thanks. Any other thoughts for the good of the cause?
Housing, housing, housing.
Yeah.
We'll just give them all your address, Leslie, and have them move in with you.
Yeah, I know. Don't make me feel guilty. It happens so easily.
I have a question I don't know if anyone knows the answer to. I know there's a lot of the next level jobs free training right now for high, whatever the word is, like in demand jobs. But if someone, like Leslie, if your person you were talking about that's in the service industry, if they would go and start that training, I don't know if it's a full-time training or a part-time training, to like fill the gap to pay their bills while they're trying to upskill themselves. Does anybody know the answer to that?
No.
I don't know the answer to that. I mean, that does keep someone from, one has to pay bills. So if you're working 60 hours a week, it's kind of hard to then also be doing next level job training.
Right.
I don't know. Nancy, do you know?
So part of our programming, if for COVID, is if they do need training, we can help them make that bridge for a few months on rent and utility assistance. But we do have a cap on that financial assistance. But we have helped with that before. So while they're trying to get training, and sometimes we pay, especially if it's CNN training, we'll help them with their items that they need for CNN training and things like that. So we kind of got out of the box a lot in 2018. So, 2008 and 2009. So
I have worked with nonprofit and for-profit training agencies, and we've used CBDG to pay for if someone attends job training, that we'll pay a certain amount for them to complete the training. And if they get placed in a job, we'll give them a certain amount to be placing that person into a job. And that can be used to pay for their own staff or to kind of help pay things that individual might need as part of their training or job placement.
And a lot of the training piece, a lot of it is free.
Right.
I mean,
that just doesn't cover your bills.
It's the loss of work income while you're taking it, if you have to do that. Again, it depends on your schedule and all of that, but that's the hard part. Okay. Good discussion. Thank you for getting us together.
Yeah, well,
lots of potential.
Thank you so much. As a matter of fact, I want to recognize Charles and Jennifer are two people who have been appointed to the committee that's going to help us develop this plan and decide where the money goes. And but I appreciate you guys coming on tonight and giving us some thoughts. So before we wrap up, remember the website, greenwood.in.gov/CDBG is where you can go. And also, I want to make you aware of a Aspire Community Matters meeting on October 28th at 3:30. We're going to attempt to do this live at the amphitheater, where we'll just continue to have more conversation about affordable housing, I believe is the panel on the topic. And know that you're welcome to feedback to us anytime here at the city. And we welcome any thoughts and ideas you have. So great.
Thank you very much, everyone, for coming.
Absolutely. And have a great evening.
Thank you.
thank you.